YouTube. YouTube seems to be taking a little bit longer to fire up. So welcome everybody. Good morning. Happy Monday morning. Today's Natural Health News live show, I'm going to share with you a boatload of research. Actually, this is literally just hot off the presses. A roadmap to pandemic resilience. We're going to go over that. You'll hear a lot more about that this week. But most importantly, today's specific topic is about a critical nutrient. It is not a vitamin as it gets categorized, but we're going to talk about vitamin D, its viral resiliency, its capacity to reduce the risk of the virus, your exposure, and minimizes the replication of that within your body. So I'm going to dig into more specifics. There's an abstract I'm going to go over, some research that was released last week, or maybe a week and a half ago. And most importantly, our live show is a format where we can come together and discuss the news currently within the virus state globally. I give you health and wellness related news that's pertinent. And then we go over health and wellness tips, techniques, and ways for you to fortify your body, bolstering your immune system, empower you and your families to be healthier and safer during this crazy time. So I, like you, am working from home, and I want to welcome all of our new viewers. If you are new, I hope you will hit the follow, subscribe button, both here on Instagram and up on YouTube. I have both of you all, these communities live, and welcome to the chat. The chat box is open, and I answer a lot of questions. And for all of you new joining, just to introduce myself, my name is Dr. Melissa Gallagher. I'm a naturopathic physician, and my focus is functional medicine and assessing the whole body to balance illness and disease. We address, as naturopaths, the root cause of illness and disease patterns and symptoms, and utilize natural techniques, methodologies like homeopathy, herbology, Chinese medicine, Ayurveda techniques, and an assortment of other resources that I am trained and credentialed in to help support you and your bodies. And today, I've taken polls multiple times with our YouTube community and also here on YouTube. I know a lot of you are very curious about how can you bolster, support, and boost your immune system. So that's what we're going to be talking about today. And so welcome. We've got Pat Wagner on the YouTube chat box, or she is our chat moderator. So she's our troll reducer and our front line to the trolling that happens here on the live show. So Mondays tend to be a little bit busier troller days. But yeah, so let's talk a little bit about our current state. I want to get into some really key information, and then we'll dive right on into the data and research that's come out of Harvard University. And then we'll dig into vitamin D and why to take it. I have some freebie resources, so stay with me through this whole show, and you'll find out how to get those resources. Okay, so first and foremost, we are globally, still increasing. There seems to be some hot spots in Southeastern Asia coming up. I've been reading more about that. Seoul, Korea is seeing a resurgence, and even folks testing positive that had already tested positive and recovered. But here in the US, we're at 770,000. Our testing resources are just still not what they are at or where they need to be. And we'll go over some of the suggestions. Some of the suggestions are even recommending 2 million tests a day for us to catch up. We've had less than 1% of our population tested. I'll tell you some stories. I have some folks in my lymphatic network and Texas. They've tried multiple times to get testing in Texas. And literally the testing sites are supposed to be open from like 10 or 11 or 9 to 7, 9 a.m., 7 p.m. At 12:50, they rolled up and there were no tests. So even though, and here I will tell you, we have a neighbor who more than likely her symptoms, she probably has the virus, and they have not been quarantining. They have not been staying hunkered down. There's been a lot of social engagements with neighbors and other parties. And I sent her a message with the links of our testing locations in Roswell. Even though there are like 6 or 7 locations where you can go, that doesn't always mean that we have the capacity for tests. So that's a challenge. And with that, I know that there is a manufacturer up in Maine that has been required to roll out the swabs for the tests. So the Defense Act, DPA, Defense Production Act, has been employed with that particular facility. So hopefully, that will kind of turn things around. But I mean, manufacturing takes a little bit of time, and sometimes they have to get materials because maybe this is different than what they might be producing. So that's just is what it is. We are seeing more identifying cases and differentiations in the nursing homes. So you're going to start to hear numbers in your state, in your area, of nursing home cases, because those are the populations that are really getting hit hardest. We're also seeing jails, for instance, in Ohio. There are 3 jails. One of them has over 1,000 cases. And you think about close quarters with jails, and then the different, workers that are there. There's medical staff, there's, emotional, psychological support staff, there's even volunteers, and then the guards and facilities professionals. So that's pretty significant. So there's 3 jails. They have 1,300 cases. One of them has 1,000 cases. So that's gotten rocked pretty hard. Amazon had announced that they've installed thermal cameras in their production facilities. And it didn't say exactly which ones, but I would imagine they're probably the larger facilities. And possibly they're pairing it up with those where they had cases. I know there were some reports of 5 cases. So that's something that is rolling out. And I would expect we'll probably see this enter into potentially the grocery stores, Target facilities and places where there's a lot of people frequenting, and it's a way to scan, thermal scanning. So, a lot of people have different ideas about the privacy component. There's also discussion between Google and also Facebook using those apps as some contact tracing and way to lower potentially the spread. So that's coming out. The other thing, I know there's a lot of concern. I had a lot of messages personally from you all about the protesters, people protesting the government, showing up, not social distancing, not wearing masks or protective gear. I saw a thing that popped up on my screen. Colorado healthcare workers actually went out, counter-protested the protesters. And they literally, like doctors and nurses, got out, and they just came out in their gear and stood in the middle of streets and blocked the protesters from actually getting out of their cars and being in a very unprotected social setting, because their concern is it puts them at risk. It puts our community at risk. So, do please consider staying at home, wearing masks if you have to be out and about. But it is still very, just because there's discussions about opening up and trying to get our economy back to normal and production of regular working hours and opening up restaurants, it doesn't mean that we're okay. And we just don't have enough data. We don't have the tests to identify who all has it. We don't even have the procedures in place, which is what I want to kind of move into here. So this is like 56 pages. I'm going to have to get ink with all the stuff I'm printing out. But I read this and I printed it. This is a roadmap to pandemic resilience. This is coming out of the Edmund J. Safra Center for Ethics at Harvard University. So, Harvard's one of our powerhouse university of just pure intelligence. And they do a lot of research, and this has been supported by the Rockefeller Foundation, just the research that they posted. And basically what they say is, what it assesses is a way to get back to normal. And so they put out this whole kind of process, and they have the authors. There's a lot of authors on here that are part of this. There are people from Microsoft. There are people from the Global Health Law, Georgetown University law professors, Harvard, T.H. Chan School of Public Health professors, fellows, graduate fellows at Vanderbilt, Princeton, Santa Fe Institute, Middlebury College, George Mason, the UN. They have even a chief technology officer with Microsoft, Harvard Law School, the Boston Review. There's a lot of even editors of American Affairs. It's a periodical. So they've pulled in a lot of experts, and what they've identified is that the goal was to kind of identify how can we get back to normal? What do we need to put in place? So they actually employ something called TTSI, and it's testing, tracing, and supported isolation, meaning quarantine. So if you get tested, and then we trace all of the people you've tested, you've come into contact with, and then we test those people, and then they test positive, we isolate them. So it is very similar to what we saw in the countries that had the curve really decrease. It is a very pointed, very specific, very targeted effect. Traditionally, you might see something like this come out of the government because it hasn't, now we're seeing our institutions and the experts and the expertise from the academic world and the real world from public health policy and folks that are boots on the ground. So this really analyzes how can we get back to normal and what's the best approach to do this, just to kind of save you time in terms of it. But they look at from now until August. They kind of talk about we are in this equivalent is worse than the Great Depression and World War II. They identify the level of testing that we need. What does isolation mean in terms of job protections? What resources are needed? What type of staff? The quantity of personnel needed for all of this. I mean, they really kind of look at the methodologies and the real specifics. But they have this, I'll just show you some little tidbits. They've got and I have this link on YouTube, so you can grab this. But this is a table of contents. Basically, they look at the concept of it, the phasing of how to do this, jurisdictional. So there's some legal aspects, business, what role business has, what role workers have, us as a civil society. And then, what we call disease surveillance and contact tracing, what that looks like, personnel requirements. They also, if you guys are familiar with General McChrystal, he was, I think, a very key player in the Afghan war. He has an institute, and they brought in his professionals to talk about that. And then testing, supply chain, logistics with testing equipment, and strategies at local levels. It's very thorough. I mean, to be honest with you, is highly impressive in terms of it just breaks down really specific details. So in comparison to last week, I think it was Thursday, we got this, very nondescript opening up America again. Take it to the educational resources and folks with extreme background. This is what they put out. Very specific details, lots of really great information. So if you're curious about, what the thought leaders in this, this is very unprecedented, but what people they've studied, what they've identified, this is kind of the mission critical plan. This is highly powerful. This will be ultimately kind of a roadmap, if you will. And that's really why they called it a roadmap. But I want to kind of drill down a little bit about what they've highlighted. The big thing that they highlight is that we're so deficient in the supply chain of testing. I announced over the weekend in yesterday's live show, the CDC had contamination. So the CDC ordinarily would be like our main testing body. They would roll out all these kits. Well, they had contamination early on, and it halted that production. And that's one of the reasons why we've gotten behind, but also for a number of just complete functional meltdowns. But they have identified for us to catch up, their recommendation is 2 million tests a day. We're on the good side. Last week, we were at 75,000 tests a day across the US. Fast forward, if we need 2 million, that's a lot of plastic components, swabs, the little thing that the swab gets stuck to, the testing mechanisms, the little plastic bags, the little stickers, all of that. It's really, really intense. So it's very important that we really, really take note of what professionals in this space that study this. There is an aspect where we go from academic theory into reality, and this is the roadmap to us ensuring that we can get over this without, multiple peaks. And, for many of us, like, I looked at Brian over the weekend, I'm like, our wedding, we postponed to a year. And part of it is to get the same location, all the vendors, there's a lot of scheduling that needs to happen. But what if this happens again to us? Like, I'm done. We will do something else. And it's very frustrating. But, that's just us and a wedding. But what if you are a small business owner and you've put all your life savings in a business? What if you just moved your family and relocated or graduated and you're starting a new job and like your livelihood is in question? You're a farmer and you can't sell your crops to your normal businesses. What do? You're a manufacturing plant. You are a large corporation. You're publicly traded and you have shareholders you have to answer to. It is so broad and so complex that none of us want to fail. And so this will be highlighted a lot this week. And so I put that out there because this is really, this is going to be critical, mission critical. So now to that note, one of the things that we can do is every day take precautions, limit our social engagements, really minimize, be cautious of who's coming into our home, who are we encountering. One of the things that my text messages to our neighbor was, are you quarantining? She has a husband and 2 kids. They're in a close quarters and close proximity. And one of the challenges with that is she was like, well, I'm trying to avoid them. That is not social isolation. Like quarantining, if you potentially have this virus, we already know before you even experience symptoms, which for hers, it was an onset of Friday evening. By Wednesday evening, she might have been already shedding the virus. If this is what she has, she was contagious on Wednesday. They had multiple social engagements where they were meeting puppies and looking at adopting dogs. And so there's a lot of people she's connected with. And so like this whole TTSI, let me bring this back here. TTSI. So 1, she's going to need to get tested. 2, tracing means who all have you contacted with? And because we would test you, let's say she gets a test today or tomorrow, depending on if the availability is there, she could wait 5 to 7 days. In that meantime, she would need to isolate, quarantine from family. And then more than likely, right now, most of it's going to be on individuals, not necessarily contact tracing is this being done substantially, but everybody she's had contact with. What grocery stores did she go to? What neighbors' houses did she go to? Who are the people who own the dogs that she met with at the park? Were there any people at the park that she knew? Like that, this is what happens. That's just one person. So one person can have contact with 100 people, and then tracing those 100 people, we would need to test them. Who tests positive, we isolate and then trace out, further out. One person not being safe, not thinking, about the severity of this. And then you fast forward to Colorado, healthcare workers are so frustrated by protesters because not only are they putting their own lives at risk, more than likely they are going to be catching some of the spread. In that social, non-social distancing proximity, completely not adhering to the guidelines of the CDC, regardless of what you think about it. We have guidelines to keep us safe. And the healthcare workers are like, you're putting my life at risk and I'm going to counter protest. And part of the challenge is we just don't have the right measures, steps in place. And so I see 2009 BA, absolutely, I can tell you people do not quarantine. No, they don't. I don't think I said to somebody over, I think it was Friday or Saturday, they were getting really frustrated about Florida. I mentioned the Florida, I'm from Florida, and the hashtag Florida morons was trending because the beach is being open, or, Jacksonville Beach being reopened. But, people we're really selfish, and that selfishness has extended beyond into this realm of our selfishness, our need to prioritize our own wants and desires. And it's not even needs. Like we need shelter, we need food, we need, touch, therapy, like I mentioned yesterday. But like the selfishness of, I want to go to my restaurant, I want to drink at a bar, I want to go to the movies. Yes, people need to be economically supported and we need people back at work. And that's a fundamental need that's met there. But there's a lot of selfishness at play where we don't think about other people. And I see Ed says, does herd immunity play a role in why California's numbers are a lot lower. So California definitely did implement a much greater sense of social isolation. The other thing too, they are employing some of these tactics in this roadmap. So that's a big one. They worked really closely with Seattle, and Seattle really cut down. I mean, the hot spot that it could have been worse. They cut it down big time. I don't think we're there, to be honest with you, at herd immunity yet. I just don't think so. And in fact, there's just a lot of information about the antibodies and the fact that people are getting infected. I just don't know. We don't have that information yet. So I can't make a statement on that. I want to see the clinical data. That in general terms, herd immunity is impactful, but I don't think when you have a novel situation that 2 months you've got herd immunity. I think we need to lower that expectation. Not that that's a factor, but this is just so unique. I think it was the actions of the government, actions of the local communities that really, really benefited and lower. I mean, but the reality is they're not out of the water. I mean, they're not out of it by any means. They're in the 30,000 range, and some of those areas are getting hard hit, but it could have been worse. And so, they're not over the peak by any means, but I don't think herd immunity is we're not at that point. I mean, maybe in a year and a half, we'd be talking differently, also vaccines and even therapeutic resources, the antibody. There's just a lot that needs to get developed before we go that route. So I just want to put that out there. I don't want us to be jumping way ahead of conclusions and going, herd immunity, we're all okay. We're not. So stay safe, stay at home, wear your mask, clean your hands, sanitize, and be safe and table selfishness. And I know most of you are not in this category, but there are a lot of people who need to hear this. And sometimes we need to get the reminder. Yes, I am sick and tired of this. I think we're on day today's 36 or 37 that I've been going live to you every day. I want to get back to normal. I miss my solo time in the car. I miss my solo time working. I miss working with people. I miss my routine. I miss Gabriel getting outside resources and not being 100% reliant on us. I miss all of that. I miss my Aldi hauls, but I'm tabling it because for the safety of everybody, our family and everybody else in our community, I can get through this. 30 days in a lifespan is nothing. It's a blip on the screen. Okay, so that's it in terms of my morning news. Give me a thumbs up if this resonates. Thumbs up, and let's applaud each other for staying safe, tabling selfishness, and digging into how to keep your lives, your families, healthy and safe. So let's talk about vitamin D. This is evidence-based. Vitamin D supplementation has the ability to support your immunity. First of all, vitamin D is not a vitamin. It's actually a steroid. It is a critical hormone in the hormone structure of our body. So in a lot of my video content, and you guys, for any of you newish to Instagram or YouTube, I've put out over 450 videos in a span of, we're coming up on a 4-year anniversary here. I've only been really full-time on YouTube, putting out 2 to 3 videos a week with YouTube for about 2.5 years now. I have a lot of resources and catalogs of video content that highlights vitamin D. It's a big player in my role of bolstering the immune health of my cancer patients, the immune health of my lymphatic patients, and any of my men and women who have hormonal imbalances, digestive grievances, skin conditions. Vitamin D, again, it's not a vitamin. It's a steroid. It is a hormone in the very top layer of hormone synthesis. Every cell in our body has receptivity to vitamin D. And what this particular report, it goes into the current virus. You guys know I can't say it, but it says evidence that vitamin D supplementation could reduce risk of influenza and the virus infections and deaths. And it goes way further into the role that vitamin D plays. And again, just consider it a steroid, hormonal steroid. So hormone supplementation via vitamin D can reduce the risk of respiratory tract infections, So read this. Any of you who have asthma, allergies, bronchial issues, lung challenges. And I posted over on my Facebook page yesterday. I kind of repurposed a video we did 2 weeks ago. And I had a ton of people say, I'm at home recovering from pneumonia. I have the virus and I've got the lung stuff. Vitamin D supplementation is critical in that. It's critical anyway, but there are several things you need to know. There are 2 core proteins that get synthesized when we have optimal vitamin D levels. And we'll get into that too. I have a free download that is accessible for all of you. That is a great way for you to analyze how much supplementation do I need. I also do blood spots. So it's like a diabetic pinprick testing. You can now do these at home and I can mail these kits out to you. We can identify where are your vitamin D levels? How sub-level, how suboptimal are they? And this actually goes into what optimal range would be looking at, what it would look like. But ideally, there are 2 proteins that vitamin D produces. So, optimal levels of vitamin D produces these 2 types of proteins. And I don't know if I'm going to say this right, but it's cathelicidins and then defensins. Okay, so defensins, those kind of are very, those particular ones are very immune boosting, but both together, they actually minimize viral replication. So go back to this virus and what it is. It's an enemy, and a single cell, it's like a big cellular viral mosquito. I hate mosquitoes. I just hate them. This little viral mosquito, if you will, it has a stinger. And so the way it works is it implants, let's say, in your sinus cavity and your oral cavity and your eyes, your mucous membrane. It stings you. So it injects with its little stinger into your body, and it doesn't suck anything out. It transplants its DNA. So it transplants DNA, and then that DNA, it's created to create more viral DNA, more viral cells. So it implants its DNA into you, and that DNA says, make 10 more of me. And so it keeps hitting, and all those cells, they also are stinging you. So it's just this massive multiplication of cells. And that's why people say, I had an onset. It was really fast. Boom. That one single stinger, in a period of an hour, you go from 1 to thousands, 1 to million of these cells, and they infiltrate all aspects of the body. Okay, so what these proteins do, they actually lower, they bolster. So vitamin D is received by every single cell in your body. So if the stinger hits a cell that has optimal D levels, we already know D coats and protects the cell walls. It fortifies them, it makes them stronger, it boosts their immunity so that when a stinger happens, that it doesn't get all the way through, or it is protective and minimizes the extent of that replication. So that's been evidenced. And also we see this in general flu. People who take vitamin D supplementation, and when I say vitamin D, the version that is the supplementational form is vitamin D3. And there's a lot of different ways to get it. I have links of some of my favorite brands, the dosing quantities. But again, based on 1, testing your vitamin D, 2, download my free dosing guide. There's a link down below. And that one gal says, if you can try to go outside at least a walk to get some sunshine every day, I'm sorry, sunshine, it does not give you enough vitamin D. That is very counterproductive. In fact, a lot of people say, oh, you just need to go outside for an hour. Nope. Most of the time, the majority of us are walking around in a deficient state. No amount of vitamin D is going to support from the sun. There's a lot of stuff that has to happen. Vitamin D is synthesized by the liver. Cholesterol is part of the collection process. So, I grew up in Florida. I know all about sun worshiping. I love the sun. When you're out and you're sun tanning, you're in the sun, you get this like really nice kind of glistening look. That glistening look, that's cholesterol. The cholesterol goes up to the skin and it absorbs the nutrients from the sun, and then it takes it back and takes it to your liver to synthesize. Well, most people have deficient livers. We're toxic beings. So there's a lot that has to play into that. There's a lot that has to be optimized for you to really get the benefits of sunshine. I just do not, I avoid that. One, the sun causes cancer. Two, if you're wearing sunscreen, you don't get that process. Three, if you have contacts like I do, or you wear sunglasses or a hat, you need to actually have the retinal sun exposure. So there's a lot that goes on that just is not, it's not possible. So I just have to throw that out there. That one gal, I know that's a good idea, but it's been proven. Supplementation is the best way to support this. When we're under stress, which we all are, our fight or flight, that depletes our D. It also weakens our immunity. It imbalances our hormone, imbalances our hormones, but also when we are in a toxic state and our livers are not functioning, anybody who has any type of cholesterol imbalances, triglyceride levels, constipative states, your D levels are not going to be optimized. So just know that sunshine is just that. You need to supplement. And the first route is test. You need to identify, quantify your numbers, because you might need 50,000 IUs for 4 months, or you might need 5,000 for 3 months to get optimal. And then you maintain with 1,000 IUs. That's the international unit. IU is the dosing. Sometimes we'll see mcgs, microkilograms. But the reality is that our concentrations do go lower in wintertime. Part of that is the sun exposure, but also it's partly the way our bodies are processing, cave women, cavemen body processing in the winter time. So a lot of times it's colder, our metabolic process changes, our food habits change, because people are eating less seasonal foods. There used to be foods in the diet, like fall foods, squashes, and some of the rich, like orange and yellow foods. Those are dense in vitamin D. And also, a lot of folks that choose vegan and vegetarian lifestyles, they're deficient in vitamin D. A lot of vitamin D comes from fish, cod liver oil, and things like that. Now, if you are vegan or vegetarian, I have a phytonutrient. So there's some extracts that we can get out of plants that are very efficient at delivering the D and optimizing that level. But this report I've referenced, and it's linked down in the YouTube description. So if this is resonating and you really like this information, give me a thumbs up. But the deficiency, vitamin D deficiency, is linked to the ARDS. So that's the acute respiratory distress syndrome. They are very, very, the fatality, the morbidity, mortality rate, they've linked up. They know for sure that folks that have D deficiency also demonstrate respiratory illness. So again, vitamin D is a fortifying nutrient. It's a steroid. It's a vitamin. It has the ability to lower the cytokines. A few days ago, I talked about the cytokine storm and what that means, and the overabundant kind of immune it's like an autoimmunity of your immune system. And it just attacks everything. It can lower the cytokines to lower a storm. It can or minimize that risk. It also is a pro-anti-inflammatory. So it lowers inflammation levels in the body. Very, very powerful at that. But also, because of this research and those two particular proteins, we have identified that we can lower viral replication. So when we're talking about keeping you, your families healthy and safe, one, we need to optimize your vitamin D. And the download that I have, the freebie download, it is very descriptive. I have kind of a pyramid, kind of breaks out like the symptoms, like this is really, it was based on, I test all the time patients for the vitamin D levels. And every 6 months, you want to test your D. Supplementation is the slowest to bring up to level. So unlike a B or a C, you can sometimes really get that moving. Those are water soluble. D, being a steroid, is fat soluble. It takes a while. And also because every cell, we have billions of cells in our body. Every cell is requiring D. When you take a hit of 5,000 or 10,000 IUs, it's like the testing kits now. You've got 1,000, 10,000 people in line, and you only have 25 or 30 test kits. Not everybody's going to get what they need. That's what it's like in the cells in the body. So you need to deliver the nutrient, the supplementation every day for a longer period of time, and we'll start to see those values articulate. The other thing, we do know that when you supplement D3, you want a vitamin K that tends to help the synthesis. I also like to employ flaxseed oil. That tends to be a very fast delivery method for vitamin D levels to get optimized. And I've been doing this, now for 12 years. And there's some significant research in that category. I want to give a shout out to Pau, who gave us a $5 super chat. Thank you. Happy Monday morning. I'm grateful. It says Pau, mom of boys.